Hello everyone, I am Dr. Tamer Seçkin and I am an endometriosis surgeon. My passion is to treat the disease endometriosis. As you may all know, endometriosis is a disease that affects females of reproductive age in their most productive years, however causing them severe loss of quality of life, subfertility, infertility, major cause of hysterectomy, and #1 cause of pain in women. Today, I will introduce you a series of very interesting individuals, professionals, and some patients who are willing to come out and share their experience with you. But let me introduce these friends of mine, my circle, who we have worked together for many years, who have also taught me, and we have shared a lot of knowledge, and that's how we work with endometriosis patients. It's a team practice. I will have two very famous, well-known reproductive endocrinologists and infertility specialists who will review their view on endometriosis. This is Dr. Avner Hershlag from North Shore LIJ system. He's a director of the GYN OB program there. And Jamie Griffo from New York University, known for his passionate work on fertility patients.
Is there ever a perfect time to have a child? Is a decision, is a question that only a woman can answer. And there is no perfect time. It's a choice. And the more we can help women make this choice that in a way that it works for them, we're doing them a great service. But there is no perfect time. Age is the single most important predictor of chance of getting pregnant for women. So we need to educate women about the age effect, and while they generally know it, I don't think they know the extent of it. And in order for women to make the best decisions about when to have the baby, they need the best information. It's our obligation to help them understand that, and then also understand the options about how to work around that, because the trend is to delaying childbearing.
Egg donation is an option for women who want to extend their fertility and extend having a child, but are kind of running out of eggs. Sometimes a woman will be in early menopause, but in many cases, she will still have her periods and maybe even produce what I call the egg of the month. However, will not respond to fertility drugs and will repeatedly, if she tries, fail to conceive by the conventional way. Egg donation eliminates the one factor that is the problem in the biologic clock, and that is the ovary. So there is a discrepancy between the aging of the ovary and the aging of the uterus. The uterus does not age for decades to come, and therefore is capable of carrying a pregnancy and helping couples where the woman is slightly older to have not only one child, but a family. So that is an extremely viable option, and to add to that now, the egg bank is a new way of doing egg donation, where eggs are being frozen by an egg bank, and the patient can independently get the eggs from the bank in a very similar way that men used to get sperm from a sperm bank.
Well, egg freezing is an option for patients who want to delay on purpose the age at which they have a child, because it allows one to freeze her eggs at a particular potential for use later when the potential is much lower. The younger the eggs, the better the chance, although it wouldn't make sense to freeze eggs under the age of 20 because those patients haven't decided what their reproductive life is, and it's a pretty invasive, expensive process. Probably we can get maximal pregnancy rates up to age 32, 33. Certainly under 35, we have very good results. As you start going over the age of 37, 38, it becomes less efficient. So if one is going to choose this option, one should consider it at a much younger age. And unfortunately, the dialogue doesn't exist for those patients generally. It's the 42-year-old who's coming in to ask about egg freezing because they feel the clock more so than a 30-year-old. The 42-year-old's thinking about it, the 30-year-old is probably not. So we need to just educate women better about fertility and what happens with age so that they can make good decisions about how they choose to conduct their reproductive lives. There are no guarantees in life. Egg freezing is a good technology. It's not a perfect technology. It offers a young woman her current fertility. So for a 30-year-old, that's roughly about a 50% chance from one batch of frozen thawed eggs of having a baby. If she were to bank more than one cycle, it certainly wouldn't be 100%, because that's not the way statistics work. It would improve her chances. But one shouldn't freeze eggs feeling that this will guarantee their future fertility. It doesn't. But it does allow a woman to be her own egg donor later if she needs it, because she may not. And it's one option that women can look at as a way to extend their fertility and ensure their future.
Age 35 is kind of a landmark that a woman should look at. And if she had not made decisions by then about having a child, she may want to start pushing on the gas rather than the brake. Age 35 is by no means the same landmark for every woman. And the younger the woman, when she, for example, either has a child or freezes eggs if she does not have a partner, the better. Where we deal with endometriosis patients, the picture may be quite different, especially for some of them. Women who have had, for example, multiple surgeries, women who have lost part or all of an ovary, may be at a compromised stage at a much earlier stage. Therefore, women, as well as their doctors, should really think of the fertility avenue as early as possible, because number one, fertility may already be compromised. Number two, you don't know what the day will bring. And if there will be further surgery, for example, for endometriosis, she might even be more compromised, and you want to jump on the wagon before it's too late.
So recently, the American Society of Reproductive Medicine has no longer declared egg freezing experimental. They are very supportive of doing this for medical indications such as cancer and the preservation of fertility for cancer patients. They aren't supportive of the concept of elective egg freezing for patients who are choosing to delay childbearing, which I don't agree with. I understand why they call it that. It is, in some respects, a bit of a social experiment. And yet, it is one more example where women can be a little bit more in control of their reproductive lives, and something that, as advocates for women, we should be supportive of that, and we should be supportive of making sure they understand fully what the meaning of egg freezing is, the fact that it's not a 100% guarantee, that it does offer some hope. It's not a promise. It's an option. It's not something that should be an obligation. It's a choice that a woman could consider. I wouldn't even say should, because women need to make their own decisions.